when you mess with the rewards in an organization, it is like you're peeling back the skull and poking at the brain matter. It is extremely delicate work because it's control. Do I have a say over this? And everybody wants autonomy and the feeling like they have a say, especially well-educated people who feel like they know what they're doing.
Especially competent people because
I know what I'm doing. Yeah. So you want to say, you want a degree of autonomy, sense of control, and you want it to be fair. And it doesn't mean we shouldn't mess with the rewards in organizations.
But you can see how this is a balance because, if you left the level the same, it's probably not going to continue to be motivating. There's a chance that it won't be motivating over time because if it's just the same, it gets easier and easier, and extrinsic rewards lose their power also if it's too easy. So like the study with DC and Ryan was in elementary schools, and they had them doing like a repetitive task over and over again. It was like, I don't know, drawing a butterfly or something like that. And initially there was much greater output and enthusiasm about the task, but
sure,
after an hour of this, you're a little bored of drawing butterflies.
Yeah.
And so it wasn't challenging to get that reward.
Yeah.
And so it is a fine balance between the two. You can see how they can be at conflict. And that's why I think you have to think about challenge as separate from busy. And you have to think about challenge as separate from there being a fair system in which I'm being judged.
Yeah. You shouldn't just listen to this podcast or read one book or listen to one Audible and change your reward structure. You should really think through it. And you want to be...
Let's give them an example.
Mm-hmm.
And I'm going to leave it to you to clean it up.
I can give two. I can give probably 22, but let's start with two. So here's one. A place that we work with sales targets, and they needed revenue. And so they basically chose to lean on their salespeople and say, we have to go up by 15% this year. And we can't talk about it. And historically, there had been a conversation, and they would set a sales target for the company and then let the different reps parcel it out a little so that you didn't have to tell your rep every year, you got to go up 7%, 7. You could say, look, I think this year I'm close. I think I can actually make mine 11. And then this person next to me can make his 5 this year because he was 11 last year and I'm going to be 5. And so, it let the team smooth it out while still meeting the number. And so this year they said, no, everybody has to go to 15. And it actually was perceived as completely unfair. It caused, the only reason the sales manager stayed is because he had 2 kids in school and couldn't leave. They were in private school and he couldn't leave, or he would have left the job. And it actually caused 2 of the people in the team to quit, because when you mess with the DNA of a reward system, everybody feels uncertainty. The people who can act on it the fastest,
Uncertainty Playbook.
Buy it where books are sold. The people who can act the fastest on uncertainty are the people with options. The people in your company with options and alternatives are often correlated with your best performers. And so boom, boom, in rapid succession, they lost 2 of their top salespeople and then asked us to come in and help. The damage was already done. The 2 were gone. And we had to take now a sales team. It was only about 9 people. 2 of the top performers are gone. They were going to have to onboard 2 people. so now how are we going to make the 15%? And everybody thinks it's unfair. And then there's people who were never going to make it, and they know that their year is going to end with a bad review. And so they're not motivated. And so it was a gigantic mess that could have been fixed by some of the very practical things that we're talking about. Number one, you have to be extremely careful when you're messing with the reward systems in organizations. Number two, you have to have a combination of, you have to protect both the intrinsic, people's feeling like, I want to do this, I think I'm a good salesperson. Because for years, the target was around 7 to 9%, and then they make it 15 because they're on hard times.
Right. That has nothing to do with the skill of the salespeople.
And it causes people who for years thought, I'm pretty good at this, to now they doubt themselves. And so now you're not stretching me and motivating me. You're causing me to think maybe I'm not as good maybe I'm not as good as I thought.
Or that the system's just not fair.
Right. Yeah. And so that's one example that I can give that we've been a part of. And then another example is also similarly, a company struggling financially decided to basically move a percentage of its company, about roughly 40% of its employees, from a base entirely guaranteed salary to reducing their base by along 50% or so. 50% base, 50% you have to reach for it, some type of incentive base. And again, I'll just use round numbers to make it easy. When you do that, you've got a third of your company, they're probably going to be fine. That's the top third. You've got the bottom third, and they're not going to make it. And they're going to either have to accept less pay, which people hate because it's seen as a demotion. And you taught me very early on in working together that never demote somebody, fire them instead, because they usually get even with demotions. And so you've got your top third going to be fine. You've got your bottom third, they're not going to make it. Many of them are going to leave. Some of them are going to have to accept a demotion, and they're going to take it out on your company. And then you've got a middle third that's going to need help
to get there.
That's right. Direction, coaching, resources, assistance to be actually able to make this. The thing you have to watch for is that you don't get a death spiral, and that as soon as you unleash this, if you unleash this change wrong, your top third has the most options. And so they will leave unless you're telling them you're going to be fine. Let's sit down. Let me show you how this works. You're actually going to make the same or more.
Let's actually get into what they can do to try to make these changes work. Like how can we actually unwind it in a better way than what tends to actually happen.
Rule number one, get a little input if you can. Bring the people whose pay you're going to change into the conversation, especially if they've been with you for a while, especially if they're smart.
I would also say, because we've been in some of these organizations where you have tried to use metrics to make it fair, but when your people don't even know how these metrics are coming out, like they don't even understand how their behaviors impact the metrics to know, yes, they know that these are the metrics that they're being scored on, but they have no idea of the connection between their behavior and the metrics.
Yeah.
Or they see that nothing they could do could possibly actually impact the metrics directly.
Of course.
And so like those are the two problems. So if you're going to use metrics, which I'm not anti-metrics, I think it's a good way to actually try to have a more concrete version. But if you're going to have them, you have to make sure that all your people actually understand how their behaviors impact it. And if their behaviors don't impact it, then maybe that shouldn't actually be a metric.
Yeah. We face this multiple times a year. We're in a lot of healthcare organizations. And so most healthcare organizations have a percentage of the way that they pay their physicians and nurse practitioners and physician assistants, basically the people seeing the patients, is based on how many people you're seeing, plus what are the patients saying about you on the survey.
A survey that is almost impossible to get anybody to respond to. And you might get 5 people to respond.
Yeah.
And those 5 people are highly motivated, oftentimes because they had a terrible experience, and it totally skews the results because you're not hearing from the 150 people who had an okay experience.
Yep. And these surveys have a name. They're called HCAHPS, and they impact, based on the scores, how much Medicare reimbursement a physician's group or a hospital gets. This is kind of inside baseball, but basically it really matters, even though no more than 1 in 10 people return the surveys, as Cindy said, and it's skewed negative. And so this is why it's one of the many reasons why we're having this conversation. It's one of the many reasons that if you're going to mess with the rewards, including the compensation, is probably the major reward system in an organization, is how people are paid, then you have to be very, very careful, and it's very tricky, and you're better off getting the input of the people you're going to be impacting so that where it's tricky, they actually feel like they've had a say, which increases, as Cindy mentioned, the word fairness. In the literature, it's called procedural fairness. I feel like I had a say, and so I can tell you, look, this is bullcrap that you're making my pay contingent on a survey, partly contingent on a survey that only 10% of people fill out, and it's skewed negative. And so then I say, as the boss, I understand that.
But we're judged by it too.
60% of our pay comes from Medicare.
So I need you to be aware of it.
And so how should
what
do you recommend?
Happens.
That's right.
So that sometimes happens. And like for those healthcare organizations, they have to bring it about where like, this is how we're being judged. And so we need you to pay attention to it.
Which is the purpose of a metric, or
right.
one of the main purposes of having these things. And so like the question is, well, how do I actually do this in practice? And then you think, well, you got to bring them in and get their input if you're going to mess with their money. And so some of you may be listening to this thinking, well, that's crazy. Like, I'm the boss. Why should? Well, if you don't, you won't have that interaction where they say, it's bullcrap, I'm getting evaluated off of this metric that almost nobody, in this case, the survey that almost nobody completes. And then you say, well, but it's really important.
Like,
here's why.
It's not optional for us.
Yeah. And so you say, what do you recommend? And they're like, well, I don't think it should be 10% of my pay. Well, what do you think? Well, 5. Well, it's 60% of our reimbursement. So 5's not enough. And so you have this is a little simplification, but then you end the conversation on, all right, I hear you. Let's walk it back to 7.5%. And so it sounds so simple, but giving somebody the opportunity to have that say and explaining the other side, and possibly where you can, making a slight adjustment, that can be the difference between somebody feeling like I can live with this and I won't exercise my options, or I can't live with this and I will exercise my options, or I don't really like this, but I don't have options. And so I'm going to take it out on you by working X% less. And so you're not going to get the upside that you thought this metric was going to give you.